Welcome, everybody. Welcome once again to Luk'A'Here, y'all, an original podcast by your host, Miss Trina, caregiver, critical thinker, and community healer, if you've been listening. Welcome to another episode, y'all, really, where the voices of caregivers rise, where the silence becomes story, and where healing is not a luxury, it's a legacy. And today we're going to dive into a topic that's shaking the soul of in-home care, it's shaking the soul of nursing and caregiving at large. Like I said, last installment, CNA versus AI versus advocacy. Because in a system racing toward automation, who is actually watching out for the hearts and hands that make caregiving human? Okay? Let's get into it, because the realities of being a CNA is basically one in a million. I can't tell you about other professions because that's not where I was. Now, I also contacted the NACA, that's the National Association for Healthcare Assistants and CNAs. And the reason why I reached out to them is because during my research, I saw that they gave the most stats on CNA. So me being nosy like I am, I had to look them up. And when I did look them up, I found something very interesting. First of all, the organization is dedicated to supporting and advocating for certified nursing assistants and other healthcare workers. Well, not so much as healthcare workers, but other healthcare caregivers. Let me say it like that. CNAs, nurses, RNs, LVNs, CMAs, they advocate for everybody. So if you want your voice to be heard and your facility is not too much up to par like you think it should be or whatever, by all means, reach out to them. Reach out to them. Not so much as to, report and start snitching and telling on them. We ain't talking about all that. We talking about advocating for better staffing ratios for CNAs, advocates for better pay for CNAs, and so far and so forth. So if you really want your voice to be heard, get in touch with one of those organizations and, see where it go from there. Now, to get into it, okay, I want to take you to the midnight shift, overnight shift, 10 to 6, 11 to 7, put your mind where it is. Okay, and a caregiver named Deja, black caregiver, don't get me wrong, she in her mid-40s, and she's from the South, and she is of the South, and she works in the South. Standing in the quiet chaos of a dimly lit patient's room, her vital signs are fine, but the caregiver spirit, paper thin, because burnout is real. It really is. Up to 37% of CNAs report significant symptoms of burnout at any given time. And that comes from neurolaunch.com. It's the first accelerated professional for early stage startup related to neuroscience. And neuroscience is anything that's studying the neurological. I just get that word so mixed up, probably because I be so tongue tied. But they are the ones that study neurology. Okay, and turnover is rising in hospitals. I'm talking about CNA turnover is rising in the hospitals. Now I can understand the nursing homes because the work is so grounded, the work is so monotone sometimes, and if you don't make your job good, then it will get boring to you. It's not up to the facility to make your job better. It's up to you to make your job better. Now, in 2024, 41.8% of the CNAs left the hospitals, and that's up from 33.7% in 2022. And that stat comes from NeuroLaunch also. Now, nearly 35% of CNAs care for 15 to 20 patients per shift, and 18% care for 25 or more. Now, I'm a witness to that. Now, that is true. Okay? That's true. That actually came from a blog at the National Healthcare Association organization. That came from them. Hospitals. I mean, when I was starting CNA, that's the place I wanted to get to, was the hospitals, because you can learn more. You can do more than just working at a nursing facility, well, a skilled nursing facility or assisted living facilities. And the wage disparity was way worse for CNAs. The average annual salary for CNAs is around $38,200, despite the emotional and the physical toll, which is true, because when they tell you how much a profession makes per year, and then they back it up with despite the emotional and physical toll, you know that's got to be some kind of low. You know that's got to be pretty low. Because when you look at it, $38,200, you only making what? $3,000 and something a month? $1,500, $1,600 every 2 weeks, and that's before taxes. Yeah, like that. So yeah, that would be, that would be disheartening to anybody that actually know their worth and know that the care that they give is what keeps the facility running. And we can't get compensated for that. I mean, we can't get properly paid for that. They figure since we the little people, we should take what's given to us and just go ahead and work accordingly. But sometimes that's just not, it just don't be enough, So to the caregivers listening, you are not machines, okay? You are not disposable. You are not invisible. You are first and foremost human, with a human touch and a human heart. Now, because the rise of AI in caregiving, yeah, they going hard. For real. They going hard on us, y'all. Because, when you look at it, they get to do, they do the things that CNAs would normally have time for. Documentation. Vital signs. Well, I'm not going to say documentation, because us CNAs, we have to have the actual input for documentation. So I just say vital signs, staff and schedules. But we going to take it to the AI side now, okay? Into artificial intelligence, okay? AI does not get tired. It does not cry in the car before clocking in. It doesn't have generational trauma stitched to its muscle memory. It doesn't. So basically, it's just a machine. It's something that's been programmed to do a specific job for a specific person. Basically. It's just like your computer. When you get your new computer, you program it to you. To your use and your use only. So, in elder care, AI adoption is accelerating. It increased by 40% over the past 3 years. And that comes from us from getnux.org. And the efficiency gains, don't get me wrong. They can be efficient. Like I said, AI is not trying to, replace the CNA. They're not trying to replace the human touch. They just want to give us CNAs a lift, help, support. That's what AI is supposed to do. So, and if it's really that way, then we as CNAs, we can't help but comply. We can't help but get into the mix. We can't help but ask our, DON for training so that we can understand this better, so that we can have something on our resume that looks good and will actually advance us to better positions. AI enabled remote devices have decreased hospital readmissions rates by 25%. And the chatbots, they now handle 80% of standard patient inquiries, easing staff workload, meaning complaints, well, the AI algorithm is different in every facility. Now, like I said, when I talk to NACA and let them know that I've been out of the game for 5 years, well, going on 6 years now. But since I'm advocating through my podcast, I would like some information, so I can give to my listeners, so that they can better, understand the CNA profession, especially for the new ones, and so that the veterans can actually advocate for better pay, for better staffing ratios, or for whatever that CNA feels that facility needs at that time. See, the facility and its head staff wouldn't know unless the CNAs step up to say something. Okay? Now y'all can organize. There's some organizations in Texas that I read about that I actually researched a little bit on, and shoot, I didn't even know they exist. Like NACA or National Nurses United. You'll hear a little bit about that as we go on, but yeah, I mean, we're not gonna treat AI like it's the devil. We're not gonna treat AI like it's something that's gonna take out a job. We can't do nothing but embrace it and use it for the betterment of our jobs and our patients. So technology can assist care, but when tech is used to replace the caregiver instead of supporting them, what are we really saying about who gets to be seen? Now, us as CNAs, we have given our bodies, we have given our souls, we have given our silence, and now they gonna be giving your job to a circuit board. Now see, the only reason why I put that in there, is because I had to think, like, this is basically actually a circuit board. So, when you program this into her, program that into that, program this for that, program that for that, then that whole setup is about actually one patient or a group of patients. It all depends on what the algorithm is. One person or a group of patients that belong to a certain CNA. Say if she got 18 people this shift, and the shift is overnight. Now you would want to have real-time vital signs to be recorded at that time, or you would want to talk into a headset to give them the documentation on this one specific resident, instead of finishing your care to run and go do it while you got 2 or 3 more lights going off. Yeah, that's aggravating. It's really, really aggravating. So if I was still on the floor with y'all, shoot, I'd be trying to ask any and everybody, what kind of AI, what we got going on here? Is this some kind of training that we have to actually have this? See, because that's me, I'm nosy. I like to make my job better. Not so much as easier, but better, because it ain't nothing easy about healthcare. It ain't nothing easy about caregiving. I'm so sorry to tell you. And if you're looking for something easy, you might as well go ahead and clock out and go find you Amazon warehouse or a Burger King or something, because that kind of customer service is not for you if you in it for a paycheck. Now, when we talk about organizing and advocacy, here's where the story turns, okay? Because automation doesn't get the final say. Advocacy does, okay? Now, we done had a couple of union wins in Texas. I'm so proud of Texas. We have had a couple of union wins. In 2022, 800 nurses at Ascension Seton Medical Center, Austin, voted to unionize the largest private sector hospital union in Texas. And that comes from nationalnursesunited.org. Nurses secured up to 19% wage increases, staffing protections, and diversity committees. Okay? These are nurses. Nurses. 800 of them. 19% wage increases. Come on, CNA. I know it's way more of us than it is nurses in Texas. I know it is. So I know in North Texas, in this wonderful, wonderful part of Texas, in North Texas, I know CNAs can get together, can have a voice, can have at least one or two representatives to represent them when, the action is taken through NACA. 800. I know it's more CNAs than that in North Texas. Probably throughout the whole state of Texas. Well, it is more nurses than 800. I'm just saying, these are the 800 that actually got together and collectively gave one voice about the working conditions at their hospital. So yeah, it can be done. If they can organize, and even though Texas is an at-will state, I already know employment is at will, I already know this. But I'm saying, if they can do it, then I know we as CNAs can do it, okay? In 2023, 98% of nurses at Ascension Seton voted to authorize a strike over unsafe staffing. Now that's all right there. Now see, that's what I mean, CNAs, when we be short. You know what I'm saying? I'm talking about, that's what I'm talking about. 98% of the nurses, they voted to authorize the strike. Now, to tell you the truth, I know good and well that, they didn't leave the hospital just, come on now, just hung in limbo. I know they organized it to where some were at work with travel nurses, or they were organizing not all at once. They were all still at work, but being represented at the same time. Even though we disgruntled with where we work or the administration that we have in place, in our facilities, we can be disgruntled all day, but we still got to do the work. If you clock in, you still got to do the work. So advocacy means organizing. Organizing means healing. And healing means honoring your labor. Simple as that. Now, what we can do as CNAs, we know the system won't save us, but community might. You get enough voices together, you get enough people together all on the same accord, and it don't have to be like to one person's facility. It don't have to be like at another person's facility. That voice needs to get together and be heard through NACA. Seriously. That voice needs to be heard through NACA, because trust me, if we, the little people, can't do nothing about it, I bet you $5 they can, because they'll be more organized. They are more organized. So, with that being said, look through some stuff. I mean, community will save us. Because trust me, too many people talking about the same thing, disgruntled about the same thing, the same topics. Trust me, it'll get somebody's attention. It'll be glad to get somebody's attention. So, you can journal the parts of, what you feel like is bad at your facility, and you can schedule your own rest. Get some rest. I know, because if you anything like me, if the facility is short, you coming. Rest be damned. And that just be the truth. If the facility is short, I'm coming. Because, nobody wants to have a bad day, especially not a careless day. And the reason why I say careless is because if you short staff, some of these patients are going to get less care. That's the reason why you should take it upon yourself. Look, if you tired, don't go by my words. Because I was considered a machine when I was out there. But if you tired, don't go. If it's your off day, go by all means, go ahead and take it. Because sometimes we can't do what the next person can do. And that's all right with anybody. Just be truthful about it. Just don't be coming all in here and you don't want to be. Now, that ain't cool. You can join caregiver coalitions, unions, or peer support circles. You can do all that. I just mentioned a couple. And you can even use my platform. If you want to come on and you want me to interview you to talk about your facility or get the word out about the great things that's going on in your facility, yeah, y'all can use my platform. I'll be glad to have you on. And trust me when I tell you this, it's not about views. It's about getting the information out there. Because what we are talking about on this podcast can help. It really can help. It can help a new CNA coming in, or it can help a veteran that's about to go out. And anything in between, this is the podcast for you. So you just remember, you are the ancestor that someone will thank for this. You are the blueprint. AI can't replicate. You are the resistance. Okay? AI can't do what we do. Now they can chart the vital signs or whatever. They can record documentation or whatever. But they can't comfort a patient that's having a dementia episode at 3 o'clock in the morning. That's just not going to happen. That's not going to happen. That's the reason why we, as humans, we as CNA, we as the so-called little people of the facilities, we are what keep these facilities going. First and foremost, period. So when you keep that thought in the back of your mind, then you'll know exactly what your worth is. Trust me, they know what your worth is too. But they're not going to address it until you do. Yeah, and that's just the truth. So before we close, I want to leave you with this. Robots can chart vitals, but they can't cradle grief at 4 o'clock a.m. Caregivers is more than a task. It's a transfer of spirit. And in every act of care, you're shaping culture. You're rewriting policy, and you're defying silence. I'm Miss Trina. And this was CNA versus AI versus advocacy. Who's protecting the protectors? Share this episode. Start a conversation. And remember, healing begins when the caregiver is seen. And that is true. Everybody think of healing as a cut or an open wound or something that's got to get better. The cut and the wound is in nursing. It's in CNA. And the only way that you can heal is if you talk about it, is if you bring attention to it and bring awareness to it. So with that being said, I hope y'all enjoyed this video. And like I said, y'all, remember to care for each other. Remember to take care of each other. And most of all, remember to help and love each other. So until next time, I'm your host, Miss Trina. And I'll see you later.